Welcome to the OrthoHOD Pro app, an app for health practitioners that tests for errors of perception and imbalances in brain chemistry. It can be used to determine whether or not a patient is experiencing errors of perception, depression, and paranoia, as well as in addictions treatment and for gauging the effectiveness of treatment and its progress. It is not meant to diagnose or treat any medical condition which requires the help of a physician. However, it is a useful tool to provide a clearer clinical picture of a patient's perceptual world and corresponding orthomolecular nutrient supplementations that they may require. OrthoHOD stands for Orthomolecular Hoffer-Osmond Diagnostic. The HOD part of the test is composed of 145 true-false questions that gauge the level of perceptual errors, paranoia, and depression a patient may be experiencing. It will also indicate whether or not the patient has thoughts of suicide, is homicidal, or is faking their answers. This part of the test was created by Drs. Abram Hoffer and Humphrey Osmond. The home screen looks as follows. This test should be introduced to patients by asking them if they would mind having their stress levels measured and giving them the following information.
This test is not a test of IQ or personality, but it will help to give us insight into any nutritional deficiencies you may be experiencing that will affect your abilities of perception. Although some of the questions are slightly strange, there are no wrong answers. Make sure to answer all of the questions based on how you are feeling right now. This will help us to determine the right nutrients to give you in order to correct any deficiencies.
Before doing the HOD section, the patient will be prompted to enter their age, sex, and date on this screen. After answering the HOD section, which takes between 10 and 15 minutes, the main menu will return, and you can either elect to do the brain chemistry section of the test, which is 39 true-false questions, or you can go to the results of the HOD test. This is an example of a normal cognition screen of an adult over the age of 26. Should any of the following four letters S, H, F, D on the top left of the screen appear, they indicate the following. S at the top stands for high suicide risk. H at the top stands for homicidal or violent thoughts. F at the top stands for faking, which means that the patient hasn't answered truthfully. D at the top stands for severe depression. If the results screen should be yellow, it indicates that the patient has scored within 10 points of established cutoff values that indicate significant perceptual errors. Should this be the case, it is advisable to tell the patient that use of any of the substances listed below the results could damage their long-term mental health. It is also a caution against medical cannabis prescription, as use could result in a psychotic episode in the patient. When the red screen appears, there are significant perceptual errors that the patient is experiencing. This is an indication to refrain from using all mind-altering substances listed. Should they be used, there is a high likelihood that their mental health will be jeopardized. In this situation, the brain chemistry section can yield useful information about what orthomolecular nutrients may be missing from their diet. The short-form test option is an emergency test for existing psychiatric or substance abuse patients if the practitioner suspects the patient is relapsing and the full test is not possible to administer. It contains 17 questions and should not be used as a standalone test on a new patient. These are the cutoff values that determine significant errors of perception for different age ranges of patients. They correspond to the red results screen of the HOD test. The brain chemistry section of the app has 39 true-false questions that give insights into some of the vitamins, minerals, and amino acids that can be used to address nutritional deficiencies in patients. Confirmation of these deficiencies is possible with blood work. This concludes the instructions for the OrthoHOD Pro test.